Hello. In this video, I will explain how to contour the SuperShape Back Support for wheelchair users presenting with a scoliosis. A scoliosis of the spine simply refers to a lateral bend, a twisting or rotation of the spine, and perhaps some flattening of the spinal curves. We may see this by the shoulders being rotated to one side, the pelvis being rotated to one side, bending to the side, a rib hump developing on one side. Because of this presentation, it means that parts of the back may not maintain contact or even be able to make contact with a flat back support surface. The areas that do make contact may be minimal, leading to discomfort, pressure area development. This can reduce a sitting tolerance. It can lead to pain or skin integrity difficulties. Within any seating system, we want to ensure an optimal alignment of the pelvis, the shoulders, the head and neck, the upper and the lower limbs. We aim to optimize overall function. We also aim to optimize pressure distribution along the person's back to ensure comfort. We may be able to minimize further progression with the correct reinforced support, offer some correction, and we can also accommodate the person's individual shaping to bring the head into a more neutral position and make sitting more comfortable. There are 3 independent pocket layers where padding can be configured to increase immersion, pressure offloading, and envelopment when required for comfort and optimum contact with the wheelchair user's unique postural shape. The pocket cell system allows contouring to adapt to virtually any spine and body shape. With increasing the number of cubes in each pocket, in each layer, you can achieve approximately 200 millimeters or 8 inches of contouring depth. In conjunction with the additional modular Spex support options, this makes the SuperShape to be a well-considered postural option for people wishing to perhaps transition from a traditional molded system into a more compact yet supportive seating system. Every SuperShape comes with a positioning kit, including a lumbar pad and 2 lateral stability wedges. 2 different densities of positioning cubes are included with every system. The pink pads are very good for most contouring situations. However, the grey foam pads and positioning kit offer firmer support and positioning when required. Step 1. A good manual assessment of posture is required. This looks at various postural factors, including where there is contact with the back support, areas of pain, if there is any postural correction possible, and what reinforcing support is necessary. We want optimum contact between the user's back and the back support to optimize pressure distribution, support, and comfort. This SuperShape has been contoured for somebody who has shoulder rotation forward on the left. This means that they would have increased pressure through their right shoulder blade if they were sitting on a flat back chair. We also have some mild hip rotation within this. Assuming the posture is not corrected, we will contour this to accommodate the posture. Step 2. We would build up areas of positioning cell pockets according to the assessment of the wheelchair user's postural needs. The firmer pads can be placed at the rear and the softer pink pads towards the front. This can be swapped around if greater sensory feedback is required, but must be evaluated for comfort. Adjustments to the contouring can be completed while the person remains seated. After initial configuration, you can remove the inner foam system, then place a pillow behind to remain there whilst you make adjustments, and then replace the system into the cover once changes have been completed. Step 4. Ensure good contact without areas of significant pressure between the user and the cushion. Positioning kit wedges can be used where additional contouring is required and can be placed within the back support cover or between the cover and the shell, providing that there is good Velcro contact to avoid the SuperShape from moving when the user is seated. Step 5. Complete the contouring chart. This is an effective method to record the actual changes in every pocket. This is a great way to track the posture of a person over time or refer to it later for any reason. Take care to assess contact with the user and the back support to ensure that contouring is in the correct place for the user's postural needs. here's a tip. To make it easier to put the pads into the pockets, it is easier if you place the pads over the pocket and pull the material up and over the pads. Pads can be folded over or rolled for more direct support. The front foam layer will then flow over the contouring to ensure a smooth and comfortable interface. Pad sizes are designed to correspond to the SuperShape size selection. There will be different size pads and pockets for different back support sizes. Glide gloves, or anti-shear gloves, are effective to reduce shear when assessing posture with the wheelchair user seated against the back support system. Ensure clothing is pulled down and not gathered behind the user when assessing final support and positioning on the wheelchair back support. With practice, this can be completed very quickly during assessments and seating provision appointments. Have a look at our other videos for cover care and maintenance and contouring chart completion. The SuperShape allows for a back support solution that can respond quickly and easily to complex postural asymmetry and changing postural needs. Thanks for watching.